always done community nursing since qualifying. I really enjoy community nursing, but like with nursing all over with the NHS, it's become quite task focused now because you don't have the time to provide the care the way you want to do it because everywhere's short staffed and getting more and more demands put on them. So being part of this pilot project was all about giving the time to care, and that's what I've always wanted to do, so that's why I joined.
You feel that because you are working with a smaller caseload and you have a named nurse system, you are given that chance and time to build good interprofessional relationships with the patients, time to do personalised care plans, look at them holistically and what's going on in their lives and everything to make sure that they're getting that plan of care that is suitable for them, because not all care plans are suitable for everyone.
In the previous community nursing, you have quite big caseloads, so you're spread quite thin because you've got a lot more patients and you cover a larger area, so you're quite restricted in the time you have to care. Whereas in this pilot project, we're in one small neighbourhood, so we're not wasting time travelling from one area to the other. We've got the small caseload, which means we've got time to spend with our patients to provide care. And I think that's quite a big difference. And the self-managing role is the biggest difference, I think, between previous community nursing and the Buurtzorg way.
Well, she's very friendly, therefore we have a good association, and she's very attentive to what's gone on during the previous 24 hours or since she last saw us. I reckon she's a very good nurse. She's very flexible. She fills in with my carer and I, if we ask for her to come on a certain time or change the times, always very reasonable about changing things and very adaptable.
Whereas now you can get hold of Tina, speak to Tina. She knows what you're talking about. You don't have to explain. You don't have to go into 2 years' history. There's somebody there. It's direct contact. It's support for me. If I've got a problem, I can phone her. It's a great help. It's more than a great help. I actually phoned her last week because Pat had a swelling on her leg and she'd been on a course of antibiotics and I didn't know whether it was necessary to call a doctor or not, and I phoned Tina for advice and she answered my question.
With the named nurse system, I have had feedback from patients that they enjoy this more because it's continuity of care. The care plan that's put in place is then continuous. You haven't got different nurses coming in, giving different advice, changing the plan of care all the time, which has been seen to delay wound healing because they've got that person coming in and the care is the same all the time. If they notice when things aren't the same or when they need a change, and we've seen quicker healing times of wounds, especially leg ulcers, and the patient is then given the appropriate care, effective care, and it's quick and they're quick to discharge then.
It's better for the patients and their family because they feel like they can talk to us, whereas sometimes when you're rushing from one patient to the other, they want to ask you stuff and they say, oh no, you're busy, I'll let you go, don't worry. Whereas now they know we've got the time to spend with them, so they can tell us all the things that are worrying them, or if they just want to have a chat, then we can stop and have a chat with them because they know we're not rushing out the door. They don't feel like they're keeping us from anything.
For me personally, it's how I envisioned nursing to be when I was going through uni and I come out of the caring industry. This is what the sort of nursing that I thought I would want to do, and come quite disillusioned with nursing when I went into the community and was questioning whether I should have chosen that as a career. And now I don't question that at all. I'm able to do the nursing that I want to do, I'm given the time to do that, and I'm seeing great outcomes because of it.
Improvement in Pat's leg, well, huge. It's a huge difference. I mean, they're completely, well, when I say completely, 95% healed now. We've been battling with them for about 2 years. And I really believe it's because she's watched it and changed dressings and done what's required, which you don't know when you only come here once every 6 weeks. Because she now knows our routine, she knows exactly what's going on here. It's definitely more personal and definitely better. It's definitely better.
Oh yes, everybody praises it. Everybody.
The structure within the NHS has always been a hierarchy there's always a manager, there's always a senior nurse, someone above you that you have to go to if you want to make decisions or if you want advice, there's someone there, whereas that's not there anymore. So I think as a team, I think that has been the biggest challenge for everyone, because not everyone is a natural leader in that they want to take the ownership of deciding on the treatment plans, because they're used to having a senior to go to and they tell them what to do. So having to step up and make more decisions, but also you have got the support of the team because there is no manager, everyone supports each other, which is quite nice. Being able to make our own decisions as a team to what's best for the team, what's best for our patients. If we see a patient that needs some training on something that it's a subject that we wouldn't normally get to do in previous community nursing, but we know it would be beneficial for our patient, we can arrange that training ourselves. We don't need permission.
It's taken a bit of getting used to, because obviously self-managing is something new. Public World have been good with providing workshops and that to help us with the self-managing aspects. It doesn't come naturally because it's quite a new thing, so we've all had to learn different job roles within that to make the self-managing process work within the team. We are quite a close-knit team, which is really nice, so while we're working through all the issues together, we're there to support each other as well. It's nice being able to make decisions about your patients when you know the patients. Someone else isn't making that decision that doesn't really know that patient. It's nice to be able to make that decision and see that then go into play and happen, and the effect that then has on the patient. I think one of the biggest challenges I've seen is people coming into the team. It's quite hard to step down if you've already come from a managing role. So I think that's one of the biggest challenges. It's not suitable for everybody.
Our coach attends meetings with us every 2 weeks, so they just ask how we're doing, how we're adapting to the new model. If we've got any questions about self-managing, making a decision, then they're not there to tell us what to do, but they can advise us. So because it is new to us, so like for instance, we had a sickness policy that didn't seem very fair. So as a team, we've created our own sickness policy. So for the legal framework, we discussed it with the coach and what we think is beneficial for the staff. She gave us advice and then we managed to put a new policy in place. We're now based in a GP surgery, so we're working a lot closer with our GPs. We found the communication has improved with the GPs and it's sped up the way we work with our patients. So for instance, in community before, if we needed some medication, then we would have to send an email to the GP, which would be picked up by the receptionist, then sent to the GP, back to the receptionist, back to the community admin, then come to us, which is quite long-winded. So now we just literally go straight to the GP's door, knock on the door, tell them what we need, and they solve the problem there and then we get straight back to our patient. So it's better for the patient and better for us.
It is working well. Obviously, it's going to have teething problems because it's new. Everybody feels that they are all equal, and I think that's the biggest thing to take from it.
From a patient point of view, we've had all positive feedback, so we know that it does benefit our patients. And from a staff point of view, we've all found that we're happier working this way. We're being able to provide holistic person-centred care, which is what all nurses want to do, but don't always have the time to do it.
I'm very happy with the team and they really are nice to work with, and that makes a huge difference to my job, to Pat's life, to everybody's. So now I've enjoyed working with them and it's been a definite improvement. I think it's a system that should carry on.
I give them full marks.